We will discuss cadasel. It is called a cerebral autosomal dominant arteriopathy with a subcortical infarct and leukoencephalopathy. The first thing is that it is an hereditary cerebrovascular disorder associated with your stroke and seizures. The other familiar or hereditary disorders you would have come across here includes your Melas syndrome or your familiar hemiplegic migraine. Into incidence, it is almost common in both males and females. The pathogenesis of cadasel is that there is a point mutation or a deletion in notch 3 gene. It is located in chromosome 19. Normally notch 3 gene is involved in cellular differentiation. What happens is that there is an arteriopathy associated with this notch 3 gene characterized by deposition of abnormal granular osmophilic material called as GOM. So there is an abnormal granular osmophilic material in the vasculature, cerebral vasculature, which leads to your arteriopathy. So it is inherited as an autosomal dominant disorder. Later on, it may lead to infarct and leukoencephalopathy. So hence the name is cerebral autosomal dominant arteriopathy with subcortical infarct and leukoencephalopathy. Next, we will see the clinical features. It has a four classical features. One is that the most common is the migraine, which typically occurs as the first symptom. And the most common age to occur is the third decade. Following migraine, you may get your ischemic infarct. Migraine, you may get an ischemic infarct, which most common in 4th to 5th decade. These ischemic infarcts sometimes may be unnoticed in your childhood period. Following ischemic infarct, you may have dementia. It's most common in 60 years and above. That is your 6th decade. Almost 10 to 15% develop this. And patients may also have a psychiatric disorders. Among the psychiatric disorders, most common is depression. So your migraine is seen as a first symptom and it is the most common in your third decade followed by ischemic infarct, followed by dementia, and your psychiatric disorder, that is your depression. Seizures, apart from this, seizures may be present. If seizures sets in, then the prognosis of the disease is around 10 to 15 years. So, coming to our diagnosis, see, it is important that to differentiate it from your multiple sclerosis, because CADASL and your multiple sclerosis almost shares your same features. The distinct entity that separates these two features is that in CADASL you get anterior temporal lobe involvement. It is a characteristic feature. The other thing is that you may have diffuse periventricular white matter lesion. Both affects the white matter, remember. The thing is that in CADASL there is anterior temporal lobe more involved or more specific. The other thing I want to stress is that although CADASL is a systemic or a neurological disorder, it also affects the systemic vessels. Hence, if you do a skin biopsy, you will find your granular osmophilic material. So, your CADASL is diagnosed by skin biopsy. It has a 96% sensitive and 100% specific. These are your GOM. So, if they ask a neurological disorder which is being diagnosed by your skin biopsy, then your answer is CADASL.